Do you know what the early signs of breast cancer are? This question, simple yet crucial, is often overlooked. Breast cancer is a disease characterized by the uncontrolled growth of breast cells, forming a malignant tumor that can spread to other parts of the body. It's important to know that breast cancer is not exclusive to women. Men can be affected too, albeit less frequently. Understanding the nature of this disease is vital in the fight against it. Awareness is our first line of defense. Knowledge of the early signs and symptoms can lead to early detection, which significantly improves the chances of successful treatment and recovery. Regular self-examinations and routine screenings are critical steps towards safeguarding our health. Remember, breast cancer is not a distant threat. It's a reality that can touch anyone's life, irrespective of gender, age, or lifestyle. But with awareness and early detection, we have the power to change the narrative. Breast cancer can touch anyone's life. Awareness and early detection can save lives. Knowledge is power, and recognizing the early signs of breast cancer is vital. It's a phrase we've heard time and again, but it rings especially true when it comes to our health. The sooner we can identify potential health concerns, the better equipped we are to address them. Let's talk about some of the major early signs of breast cancer. First and foremost, lumps in the breast or underarm area are often one of the earliest indicators. These lumps may feel different from the surrounding tissue, often harder or with an irregular shape. Now, it's important to remember that not all lumps are cancerous, but any new or changing lump should be checked by a healthcare professional. Next, changes in the size or shape of the breast can also signal a problem. A sudden enlargement, shrinkage, or asymmetry between the breasts, which wasn't there before, should not be overlooked. This could be subtle, so staying familiar with your own body is key. Another sign to watch for is changes in the skin on or around the breast. This could include redness, swelling, or a texture similar to the skin of an orange, known as peau d'orange. Similarly, changes to the nipple, such as becoming inverted or developing a rash, can also be early warning signals. Lastly, unusual discharge from the nipple, particularly if it's bloody or clear and not associated with breastfeeding, is another symptom that warrants attention. Remember, these signs do not automatically mean you have breast cancer, but they should prompt a visit to your healthcare provider. It's always better to err on the side of caution, and early detection can make all the difference. It's about giving yourself the best chance possible because you're worth it. So stay vigilant, stay informed, and most importantly, stay healthy. So, when should you consult with your doctor? That's the question that's probably been circling your mind since we began this conversation. The answer, quite simply, is as soon as you notice something out of the ordinary. Breast cancer is not a condition to be taken lightly, and an early diagnosis can significantly increase the chances of successful treatment. So if you notice a change in the size or shape of your breast, or if you find a lump that wasn't there before, it's time to pick up the phone and make an appointment. Persistent changes to the skin on your breast, such as dimpling or puckering, changes in the appearance of your nipple, or unusual discharge, are also signs that you need to see a healthcare professional. But what if you're not experiencing any symptoms? Does that mean you're in the clear? Well, not necessarily. Regular screenings are a crucial part of catching breast cancer early, especially if you're over the age of 40 or have a family history of the disease. Even without symptoms, a mammogram can detect breast cancer up to 2 years before physical symptoms develop. And speaking of family history, if you have a first-degree relative, a mother, sister, or daughter who has had breast cancer, your risk is nearly doubled. If 2 first-degree relatives have been diagnosed, your risk is 5 times higher than average. For that reason, if breast cancer runs in your family, it's even more important to keep a close eye on your health and consult with your doctor regularly. Remember, your doctor is your ally in this journey. They are there to answer your questions, address your concerns, and guide you through the process of screenings, diagnosis, and treatment if necessary. And don't worry about causing a fuss or wasting their time. Your health is their priority. So even if you're unsure or think it's nothing, it's always better to err on the side of caution. Don't hesitate to consult your healthcare provider if you notice anything unusual. Understanding the stages of breast cancer can help demystify the disease. That's what we're diving into now. The stages of breast cancer are categorized using a system known as TNM. T for tumor size, N for lymph node involvement, and M for metastasis, or spread of the disease to other parts of the body. This system helps to provide a comprehensive picture of how far the disease has progressed. We'll start off with stage 0. This is also referred to as in situ or non-invasive breast cancer. At this stage, the abnormal cells are confined to the ducts or lobules of the breast and haven't spread to the surrounding tissue. It's like a seed that hasn't started to grow roots. Next up is stage 1. This is considered early stage breast cancer. In stage 1, the tumor is up to 2 centimeters in size and hasn't spread to the lymph nodes or other parts of the body. Think of it as a small sprout that started to grow but hasn't spread its roots far and wide. Now we move on to stage 2. This stage is divided into 2 categories, stage 2A and IIB. In stage 3A, the tumor is still small, or there may be no tumor at all, but it has started to spread to the nearby lymph nodes. In stage 3B, the tumor is larger, up to 5 centimeters, and may have spread to a few lymph nodes. This is akin to a plant that's growing bigger and starting to spread its roots. Stage 3 is known as locally advanced breast cancer. Here the tumor may be larger than 5 centimeters and the cancer has spread more extensively to the nearby lymph nodes. It's like a plant that's grown quite large and has an extensive root system. Finally, we have stage 4, which is metastatic breast cancer. This means the cancer has spread beyond the breast and nearby lymph nodes to other parts of the body. This could include the bones, lungs, liver, or brain. It's like a vine that's grown out of its pot and started to intertwine with other plants. Each stage of breast cancer has its own unique characteristics in terms of tumor size and spread, but remember, a stage doesn't define you or your journey. It's merely a tool that helps healthcare professionals to tailor the most effective treatment plan for your individual situation. In the next scene, we'll talk about what some of those treatment options might look like. But for now, remember this: knowing the stage of cancer can help doctors determine the best treatment options. And the more you understand about your condition, the better equipped you'll be to navigate the path ahead. Treatment for breast cancer varies based on the stage and individual circumstances. Let's delve into the various options that modern medicine offers. Firstly, surgery is often the initial course of action. The type and extent of surgery depend on the size and location of the tumor, as well as the patient's overall health. Lumpectomy, where the tumor and a small surrounding area of healthy tissue are removed, is commonly performed for early-stage cancers. Mastectomy, the removal of the entire breast, may be necessary in more advanced cases. In some instances, reconstructive surgery can also be discussed and planned. Following surgery, it's common for patients to undergo radiation therapy. This treatment uses high-energy rays to destroy any remaining cancer cells. It's typically administered over several weeks, with sessions lasting only a few minutes each. Radiation therapy can be delivered externally by a machine or internally through small radioactive pellets. The method depends on the specific characteristics of the cancer and the patient's overall health. Chemotherapy, another treatment option, uses powerful drugs to kill cancer cells throughout the body. It's often employed when there's a high risk of the cancer spreading or returning. Chemotherapy drugs can be administered orally or injected directly into the bloodstream. The treatment is usually given in cycles, with periods of rest to allow the body to recover. Targeted therapies, a newer form of treatment, work differently from traditional chemotherapy. These methods specifically target cancer cells, leaving healthy cells largely unharmed. The goal is to block the growth and spread of cancer cells while limiting damage to healthy cells. There are several types of targeted therapies, including hormone therapy, which blocks certain hormones that could be helping the cancer grow, and immunotherapy, which helps the body's immune system fight the cancer. It's important to note that these treatments can be used alone or in combination. The choice depends on the specifics of the cancer and the patient's health. For instance, a patient might have surgery followed by radiation therapy or chemotherapy combined with targeted therapy. The side effects of these treatments can vary widely. Some common side effects include fatigue, hair loss, nausea, and changes in skin and nail appearance. However, numerous strategies and medications can help manage these side effects, ensuring patients maintain the best possible quality of life during treatment. It's crucial to remember that each person's journey with breast cancer is unique. What works well for one person might not work as well for another. Treatment plans are highly individualized, and doctors work closely with patients to develop the best approach. In conclusion, the landscape of breast cancer treatment is vast and continuously evolving. From surgery to radiation, chemotherapy, and targeted therapies, there are many ways to fight this disease. Together with your healthcare team, you will decide the best treatment strategy for you. You are not alone in this journey. Support is available. As we navigate through the stormy sea of breast cancer, it's crucial to remember that we don't have to sail solo. There are different types of support available, and each plays a significant role in the healing process. Emotional support, for instance, is a lifeline that can anchor us in times of turbulence. It can come from a variety of sources, from a comforting chat with a close friend or family member, to professional counseling or support groups where we can share experiences and emotions with others who are on the same journey. Financial support, on the other hand, is often a practical necessity. The cost of treatment can be overwhelming, but there are many organizations and foundations dedicated to providing financial aid. They can help with medical bills, travel expenses for treatment, and even everyday living costs. But let's not forget logistical support. This encompasses a wide range of help, including transportation to and from appointments, meal preparation, and assistance with household chores. It's about making the day-to-day manageable so you can focus on healing. The importance of a strong support system cannot be overstated. It can provide a sense of stability and normalcy in a time when everything else might feel uncertain. It can alleviate the burden of stress and anxiety, allowing you to focus on your health and well-being. Yet it's essential to remember that reaching out for support is not a sign of dependency or weakness. On the contrary, it's an act of strength and bravery. It's about recognizing that we are human, that we have limits, and that it's okay to lean on others when we need to. So whether you're in the early stages of diagnosis or in the midst of treatment, know this: you're not alone. There are hands reaching out to hold yours, to help you stand strong, to help you through this journey. Remember, reaching out for support is not a sign of weakness, but a strength. Breast cancer is a journey that no one should walk alone. As we draw this conversation to a close, let's take a moment to remind ourselves of the key points we've discussed. First, we explored what breast cancer is, a condition that, while initially alarming, can be managed and treated effectively with the right knowledge and care. We learned about the early signs, the subtle changes in our bodies that could signal the onset of this disease. These signs may be as subtle as a change in your breast size or shape, or as noticeable as a lump or thickening that feels different from the surrounding tissue. Knowing these signs is half the battle. The other half is understanding when to seek medical advice. We discussed that any noticeable change should prompt a visit to your doctor. Remember, it's always better to be safe than sorry. Our discussion then moved on to the various stages of breast cancer, from the earliest stage 0 to the more advanced stages. Understanding these stages is crucial, as it helps doctors determine the most effective treatment strategy. And speaking of treatment strategies, we delved into the various options available. From surgery to radiation, chemotherapy, and hormone therapy, we learned that medical science has come a long way in treating breast cancer. Each treatment option is tailored to the individual, factoring in the stage of the cancer, the patient's overall health, and their personal preferences. Finally, we emphasized the importance of support during this journey. From professional medical support to emotional support from friends, family, and support groups, no one has to face this journey alone. In conclusion, awareness is our greatest weapon against breast cancer. The more we know, the better equipped we are to detect it early, seek appropriate treatment, and encourage others to do the same. Stay informed, stay vigilant, and remember, you are not alone.